Our Across the Aisle segment tonight, British baby Charlie Gard will have his life support turned off against his parents' wishes after the British government refused to continue paying for his medical care. The baby, Gard, suffers from a rare genetic disorder known as mitochondrial DNA depletion syndrome. His parents wanted to take him here to the U.S. for experimental treatment, but instead the hospital and the government made the decision to force Charlie to die. With me now, attorney and Democratic strategist Adam Sostrin.
Hey,
Adam, thanks for being here.
Always a pleasure to be here at the set with you, Liz.
Adam, this is such a tragic story here, and my question for you is this is an example of single-payer health care, where the government and a system of courts decide ultimately between life and death for a human being, and the family members have no say whatsoever in this. Does that situation, this example, does that bother you as a Democrat, given that the leaders of your party, including Senator Elizabeth Warren, are calling for that same healthcare system to be brought here?
Well, I think that's sort of an unfair comparison to say it's the same healthcare system, to say the United States is going to devise the exact same single healthcare system that Great Britain would devise, or as I think you talked about in earlier segments, Cuba or Venezuela. I don't think that would happen in the United States. I think there are going to be problems. I think there are problems in our current system. Currently with respect to the new Republican plan, are people
Adam, wait a second. That's the same argument that Democrats always make about communism and socialism too, that it just hasn't been done correctly. But if someone else comes along and does it correctly, it'll work differently. What would possibly make you think that it would be different than any of the others that I've named?
Now I took the same political science courses. I don't believe that we're going to come up with the Marx utopia. I wouldn't advocate that. I wouldn't advocate for outright socialism. We do have problems. We have a problem with the new healthcare initiative that's being, brought forth by the Republicans. It's not working out. We talked about it before. The CBO came back and said, hey, there's going to be 22 million people that aren't going to be insured under this plan. So what do we do? What's the solution?
Right.
And we have these and just to be fair, and this should be like a good dialogue between Democrats and Republicans. We both know that we have these rising medical care costs, and at some point, or it already is, unsustainable.
Right. No, I don't disagree with you here. I do want to answer your question. What is the solution here? The solution that's being proposed by members, the leadership in your party, Senator Elizabeth Warren, she's taking the lead on this. She says Obama tried his best with Obamacare, but it's time for the next step. The next step, she says, is single-payer health care. So that's what I want to talk about, because if we're talking about improving from the current system, improving from Obamacare, and moving to single-payer, I mean, my question is, why would we think that that works? Because where in the world has that ever worked?
Well, I mean, even Donald Trump praised the single-payer system in Australia. I think that just happened in May, and he did the same thing with Canada. So Donald Trump appears to think that it works in both of those countries.
No, I'm asking you what you think. I mean, I don't think it works in Canada. I can see the cancer patients in Canada that cross the border into Buffalo, New York, and into Wisconsin. They come down here because the government won't pay for the latest experimental treatments that ultimately either elongate or save their lives. They come down here to the United States. They pay out of pocket themselves, and then they go back there and they get embroiled in legal battles with the government trying to make them pay for it. Do you want that here?
I would imagine that what we would devise, and you and I mean, we're not experts with respect to when it comes to these healthcare rules, but I would imagine it would be some type of a hybrid. I couldn't imagine an absolutely devastating system where people are just left out on the streets to die. I mean, there are issues with single payer. I mean, is everyone going to be waiting in line? Do we like that? But on the other hand, do we like the fact that, right now, healthcare costs, I think it's upwards of 17% of our GDP. It's unsustainable. So what do? We're trying to come up with a solution. The Democrats, we weren't able to come up with it right away, or it hasn't worked with the exchanges. The Republicans, certainly, they're failing. It's the least popular legislative platform that I can remember. 16 and 17% approve it. So what do? What is the answer? Well, at some point, if it is so unsustainable, then single payer may actually end up being the option.
But why would we want to jump out of the frying pan? And I agree with you that the Democrats have failed and that the Republicans are acting. I mean, they haven't quite failed yet, but they're acting in a very disappointing manner. Why would we jump out of that frying pan and into the fire when you yourself just listed what's wrong with single payer? There's lines that you have to wait in. There's rationing that we can see for ourselves. Government and bureaucrats, the people that we elect, and then people that are appointed that we don't even elect, get to tell us what medical care we need. Well, why would we want that system?
I mean, I would say that the Republicans are putting the poor in the frying pan with respect to they're cutting taxes of people that are making over $250,000 to make it so a bunch of other people aren't going to be on Medicare. So clearly we have a problem here. We have unsustainable medical care costs. And it seems to be that single payer, just economically speaking, might be a path forward. It might be the only economic way that's sustainable. Like if you look at Japan, if you look at other countries, people are spending.
Well, let's look at the other countries. I mean, in France is held up, and this is not a third world country like Cuba or Venezuela, where people can't even get surgery, where they're evacuated from the maternity ward because of tear gas. If we look at France, which is a westernized, developed country here, 90% of their citizens have to purchase supplementary insurance in addition to what the government supposedly provides them for free, because it's what the government provides them isn't enough. It doesn't keep them healthy. Why would we want to copy that?
Right. Again, that would be some type of a hybrid, right, that France developed. And of course, I would never compare us to Venezuela. Venezuela is a country that seems to be falling apart at the seams.
Right, no, they're a failed state, I know, but even if you look at the United Kingdom, if you look at Canada, if you look at France, I don't think the American people want any of those three systems where the government denies you care and decides how much your life is worth, whether it's worth the money elongating it. I mean, in the United Kingdom right now, not only the example of the baby, if you're fat in the United Kingdom, Adam, if you smoke in the United Kingdom.
This is why I swim. This is why I've been
well,
swimming.
good, because you don't have to deal with that, but these people who choose not to in the United Kingdom are now being denied care. They're being denied surgery because it's not worth it to the government to pay that much for surgery when the quality of their life is so low anyway. That scares me, and I think that the majority of the American people agree. We have about 15 seconds, but you usually complain that I don't give you the last word, so it's yours today.
Great, no complaints. Well, in California, they were talking about single payer, and the idea was that it would be a 15% increase with a 15% payroll. That we would, that would be in addition to what we'd have to pay. But considering how much people are paying in premiums and deductibles, that suddenly becomes attractive. I understand your point, but economically speaking, it's not feasible for so many families to exist with the system we have.
Well, fortunately, the California Assembly dropped that because they didn't know how they would pay for it. They're yelling at me in my ear, Adam. I got to go right now.
No problem.
Thank you for being here.
Thanks for having me.